Welcome to Therapy Thursdays. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hello.
And we have Johnny Pye, our digital marketer, with us again today, and we are physical therapy and balance centers. We've had a segment on balance, several segments on balance, and today we're going to have another one. And today we're going to talk about something called BPPV. And what does that stand for?
It stands for benign paroxysmal positional vertigo.
Yeah.
Or easier said, BPPV. And what that is in our inner ear, we have 3 canals that are in our inner ear system that kind of tell our brain and our eyes how our head's moving, okay? So sometimes, as a lot of people have heard, we have little rocks in there in our inner ear, and those rocks get in the canal, and that interferes with the signals going to your brain. So again, movements tell your brain what you're doing, which tells your eyes what to do. So whenever those rocks get in the canal, it will send a signal to your brain that you're making a different movement, and your eyes are trying to figure out what's really happening because it's sensing something else. And you'll get an astigmas, meaning your eyes will jump side to side or they'll rotate. Depends on which canal that they're in. That's why we have this test called the Dix-Hallpike test that we do to determine. It does require someone that is very well trained in this to be able to look at your eyes and tell what is going on. Now, we do here at Fyzical, we have the IR goggles, infrared videography goggles, that we can put on in case we can't see it with our eyes. We can video it, and that way we can watch it in slow motion in different ways to help determine exactly what's wrong, because then that tells us how to treat you. And there's only about 50 different ways to treat somebody with benign positional paroxysmal vertigo. And whenever you get the crystals or the rocks in your canals, what you're going to sense as a person experiencing it is as if you were thrown in a dryer and you're spinning around. Because when you lay down, you turn your head too quick or whatever, your whole environment will look like that, look like you're in a dryer. It is spinning, out of control. You're scared to death. You don't know what's going on. 97% of the time with vertigo, which is different than dizziness. Vertigo, your environment spinning. Dizziness can be a lot of different things, okay? With lightheadedness, nausea, all that kind of stuff, okay? But vertigo, 97% of the cases of vertigo are BPPV. And if you come directly to Fyzical, we can normally treat you, if you're early on, normally 1 to 2 treatments and you're good. I've had patients that come months after taking different medications, their PCPs prescribed them, and they're still fighting it. So it's completely debilitating, but very easy to correct if the person knows what to do. All of our staff have advanced training in this. Johnny, if you'll spin around here, I'm going to demonstrate real quick. Scoot back up this way a little bit, okay? You're going to grab my hand, okay? And I'm going to turn your head this way, okay? So this is the Dix-Hallpike, and we're going to go down real quick, Johnny, okay? You keep your eyes open so I can see what's going on. 1, 2, 3. Go down, and I'm watching his eyes the whole time. And if his eyes were jumping around, which Johnny isn't affected, so they're not, okay? You can turn around there. That test will tell me exactly where those crystals are. And again, if we can't see that, we have these goggles that will video it, and they put that on. We do the test, we got it recorded, and again, that's all at our physical locations. The month of September is National Fall Awareness Month. Here at all of our physical locations, we are doing free fall assessments in the month of September. All you have to do is call our 800 number and make an appointment, and we would love to help you love your life.